The flatline alarm shrieked through Redstone Regional Medical Center at 6:47 in the morning, and nobody moved fast enough. A veteran was dying in room 14. The nurse who'd been screaming warnings about him for 3 hours was being physically dragged toward the exit by 2 security guards, her badge already stripped from her scrubs. Then the windows shook. The ceiling lights flickered. 3 military helicopters dropped out of the gray sky and hovered over the hospital roof like they owned it. Every person in that building stopped. Some looked up. Some looked at the nurse being thrown out. Nobody understood yet that those 2 things were connected, and that the woman they were discarding was the only reason any of them were about to survive the next hour. If this story already has you holding your breath, follow along, hit like, and drop a comment telling me what city you're watching from. I want to see how far this story travels. Let's go. Emily Carter had been awake for 19 hours when security found her standing outside room 14 with a chart in her hand and a look on her face that nobody at Redstone Regional knew how to read. She wasn't crying. She wasn't threatening anyone. She was just standing there, holding a printout of vitals she'd pulled herself because the attending on call hadn't responded to 2 pages, and the charge nurse had told her to document her concerns and let the physicians handle it. She had documented, twice. The physician still hadn't come. The patient in room 14 was a 63-year-old Army veteran named Harold Sims. He'd been admitted 2 days ago for what the intake team had logged as stable chest congestion with mild fever. Emily had taken over his care at the start of her overnight shift, and within 40 minutes she knew something was wrong in a way that went beyond the numbers on the chart. His neck veins were distended. His blood pressure had dropped 11 points since afternoon. He was restless in a way that wasn't anxiety. It was the low-oxygen restlessness she'd seen in the field, the kind that meant the body was starting to ration itself. She'd flagged it to the charge nurse at 11 p.m. His SATs are 94, Emily. That's not critical. It's trending. He was 98 2 hours ago. Document it and keep monitoring. She'd documented it. She'd kept monitoring. At 1 a.m., she'd paged Dr. Victor Langford directly, bypassing the chain of command she'd been told to respect, because the man's breathing had changed, and she wasn't willing to wait anymore. Langford hadn't answered the first page. He'd answered the second one at 1:23 a.m. with the kind of voice that made it clear she'd woken him up, and he found that personally offensive. "What exactly are you telling me, nurse?" "Mr. Sims is showing signs of tension pneumothorax. Decreased breath sounds on the left, tracheal deviation, dropping pressure. He came in with a chest infection. You're describing a surgical emergency based on bedside observation at 1 in the morning. I'm describing what I'm seeing, Dr. Langford. And I'm telling you that float nurses do not diagnose. You monitor, you document, you call the attending on call, which is not me, by the way, and you let the physicians make clinical decisions. Are we clear?" She hadn't answered right away, and the silence had apparently irritated him more than the call itself. "Are we clear, Miss Carter?" "Yes," she said. She hung up and spent the next 40 minutes on the phone with the on-call attending, a Dr. Morrow, who was pleasant and apologetic and said he'd be there in 20 minutes. He showed up at 2:45 a.m., spent 8 minutes with Harold Sims, adjusted his IV fluids, and told Emily the vitals were within acceptable range for his presentation, and that she should trust the diagnosis. She'd stood in the hallway after he left and looked at the closed door of room 14 and felt something she hadn't felt in a long time. Not anger. Anger was too hot for it. It was the cold, focused dread of someone who knows what's coming and can't stop it. By 5 a.m., Harold Sims was agitated and barely coherent. By 6 a.m., his oxygen sat had dropped to 88. By 6:30, Emily had paged 3 people, physically walked to the nurse's station to report the change, and written a formal escalation note in the chart. The charge nurse had finally called Langford. Langford had responded by coming to the floor, not to see the patient, but to find Emily. He'd walked up to her in the hallway with 2 residents flanking him like they were there to witness something. He was a tall man, broad-shouldered, with the kind of institutional authority that came from 20 years of never being told no. His coat was pressed. His face was not. "You paged me at 1 a.m. with a diagnosis you're not qualified to make. You've created documentation that implies negligence where there is none, and you've now caused a disruption on this floor that is affecting every patient and every staff member here." He kept his voice low. That was what Emily noticed, the way he kept it low, like he was being gracious by not humiliating her louder. "You are a float nurse, a temporary employee. You rotate in, you follow protocol, you rotate out. You do not decide what constitutes an emergency. You do not go around attending physicians, and you absolutely do not imply, in writing or otherwise, that this department is failing a patient." Emily looked at him. "His trachea is shifting, Dr. Langford. I've reviewed his chart." "When?" The question hung there for a second. Langford's expression shifted, not into anger exactly, into something harder. "Excuse me? You said you reviewed his chart. When did you do that?" One of the residents looked at the floor. The other one kept his face very still. "Know your place," Langford said quietly. "This is your last night on this floor. I'll be speaking to staffing first thing in the morning." He walked away. Emily didn't follow. She went back to room 14 and stood at Harold Sims' bedside and watched his chest move in that labored, uneven way, and thought about the things she used to be able to do when someone in front of her was dying and no one was stopping her. She'd been good at it once. More than good. She'd walked away from it deliberately 3 years ago for reasons she didn't explain to people at Redstone Regional because people at Redstone Regional didn't ask. She was Emily Carter, float nurse, quiet and forgettable, the one who showed up on time and left without drama. That was the version of herself she'd built here. Careful. Contained. Invisible by design. But Harold Sims was turning blue in front of her and the attending was gone, and Langford had just told her to know her place, and the version of herself she'd carefully buried was starting to push back up through the surface, like something that had never really agreed to stay down. At 6:43 a.m., Harold Sims flatlined. The alarm went off and Emily was already moving, gloves on, calling the code, pushing the crash cart herself because there were exactly 4 seconds between the moment an alarm triggers and the moment a human brain processes it and decides to act, and she had stopped wasting those 4 seconds years before anyone at this hospital had ever heard her name. She was doing compressions when the security guards arrived. She didn't notice them at first. She was counting, focused on the feedback of Harold's sternum against her palms, watching his color, listening to the respiratory tech who'd appeared in the doorway and hadn't yet come in. "Come in or get out of the doorway," she said without looking up. "You're blocking the cart." The tech came in. The code team arrived 40 seconds later, a junior resident named Dr. Ferris, 2 floor nurses, and a respiratory therapist. Ferris took over compressions. Emily moved to the airway because that was where she was most useful, and she knew it without being told. She intubated Harold Sims in 11 seconds. The respiratory therapist made a sound that wasn't quite professional and wasn't quite a compliment, but was somewhere between both. That was when the security guards, 2 of them, big guys in Navy uniforms, stepped up beside her. "Miss Carter, we need you to come with us." She didn't stop bagging. "I'm in a code. Dr. Langford has authorized your removal from this floor pending a staffing review. You need to come with us now. Tell Dr. Langford there's a code in room 14 and the patient needs—" "Miss Carter." The larger guard put a hand on her arm. She looked at the hand, then she looked at Dr. Ferris, who was watching her with an expression she couldn't fully interpret. Part uncertainty, part the specific discomfort of someone who knows what's happening is wrong, but doesn't know what it costs to say so out loud. "Keep the rate at 100, she told him. "His left lung sounds are absent. If he doesn't respond in the next 2 minutes, someone needs to decompress the chest. Needle or tube, you pick, but don't wait." Ferris nodded. The guards walked Emily Carter out of room 14 and down the hallway toward the elevator, and she didn't fight them because fighting them wasn't the point, and because she was already thinking about the documentation she'd filed and the timestamps on her pages and what Ferris was going to do in that room without her. The elevator doors opened. The guards stepped in. Emily stepped in. The doors closed. Then the building shook. It wasn't an explosion. It wasn't an earthquake. It was the kind of vibration that travels through concrete and steel when something very large and very loud is directly overhead, and the fluorescent lights in the elevator flickered once, and the guard on her left grabbed the handrail without thinking about it. "What the hell was that?" the smaller guard said. The elevator opened on the ground floor and they stepped out into the lobby. And through the floor-to-ceiling windows, Emily could see the sky outside had changed. 3 helicopters, Blackhawks, military configuration, no civilian markings she could see from here, were descending toward the hospital's rooftop helipad in a pattern that was anything but a normal medical transport. Normal medevac birds came in one at a time. Normal medevac birds didn't fly formation over a regional hospital in a mid-sized American city at 6:47 on a Tuesday morning. The lobby had gone quiet the way places go quiet when something is happening that no one has a script for. Nurses stood at the admissions desk not moving. A man with a visitor badge stood halfway between the door and the elevator bank, just staring at the ceiling. The security guard at the front desk had his radio to his ear and was saying, "I copy that. I don't know. I'm looking at it right now." Emily's escort had stopped walking. Both guards were looking out the windows. She took a step sideways. "Hey," the larger one started. "I'm not running," she said. "I just want to see." She crossed to the window and stood there and watched the helicopters come down, and felt something she recognized. The specific involuntary alignment of her breathing and her heartbeat that used to happen when an op was transitioning from planning to execution. Like something clicking into place, like her body remembering a language her mind had been trying to forget. The side doors of the hospital burst open. They came in fast, 8 of them, in tactical gear, no hospital identification, moving with the kind of practiced precision that cleared a lobby without raising weapons simply by the way they moved through it. People got out of the way, not because anyone told them to, because there are certain categories of human movement that the body recognizes as requiring immediate deference, and these people were that category. Their commander walked 3 steps ahead of the others. He was maybe 45, compact, with a jaw that looked like it had been carved with something blunt, and he moved through the lobby without looking at anything that wasn't directly relevant to his objective. He reached the admissions desk in approximately 9 seconds. "I need to speak with hospital administration, now." The admissions clerk blinked. "Sir, visiting hours don't start until—" "This isn't a visit." He held up a military identification and set it on the desk without breaking eye contact. "I'm Commander Dale Rourke, SOCOM Medical Response Unit. You have a patient in this facility who falls under federal protective status. I need your administrator, your chief of medicine, and your head of security in the same room in the next 4 minutes. I also need every staff member currently assigned to room—" He glanced at something in his hand. 7, 8, and any adjacent trauma bays cleared and available. The clerk looked at the ID, then looked at the 8 tactical personnel arranged in a loose perimeter behind him, then picked up the phone. Rourke stepped back from the desk and turned to scan the lobby, and his eyes moved the way trained eyes move. Methodically, not panicked, cataloging and sorting. He swept past Emily once, then came back to her. She hadn't moved. She was still standing by the window, still in her scrubs, badge gone because it had been confiscated, watching him. Something crossed his face. Not recognition, not yet. More like a question. He walked over, stopped 6 feet from her. "Are you staff?" "I was," Emily said. "About 8 minutes ago." He looked at her scrubs, at the absence of a badge, at her hands, which were steady at her sides. "What's your name?" "Emily Carter." Nothing happened for a second. Then one of the personnel behind Rourke said something quietly into his earpiece, and Rourke's posture changed in a way that was subtle and total, like a frequency shifting. He took a half step toward her. "Say that again." "Emily Carter," she said. Rourke turned to the man at his shoulder, a younger officer, early 30s, who was now looking at something on a tablet. The younger man looked up. He gave Rourke a single nod. Rourke turned back to Emily. "Are you aware that you have a federal protection status flag attached to your discharge record?" "I didn't think anyone was still running that." "We're not. We activated it 40 minutes ago when we confirmed you were employed here." He paused. "We weren't sure you'd still be using your real name." Emily was quiet for a moment. "Why 40 minutes ago?" "Because the patient in the unit we're responding to has been asking for you specifically for the past 6 hours, and we've been trying to confirm your location since 0200. He said it flat, like a briefing. "His condition has been deteriorating. He named you. He used your call sign. Everything in the lobby was noise and motion around them, and Emily stood in the center of it, not moving. What call sign? She said, though from the way she said it, it wasn't entirely a question. Valkyrie, Rourke said. She closed her eyes for exactly 2 seconds. She'd left that name behind 3 years ago along with everything else. Left it in a country she never talked about, with a unit she hadn't contacted since her discharge, after an operation that had given her enough material for nightmares that still showed up unannounced, sometimes at 3 a.m. when the apartment was quiet and her brain decided to run the footage again. She'd come to Redstone and become a float nurse and learned the corridors and the protocols and the charting software and the names of every patient she'd ever cared for, and she had been good at it, genuinely good at it, and she had been building a life that fit inside the boundaries of what she'd decided she was allowed to want now. And now Rourke was standing in front of her saying Valkyrie in a hospital lobby while 3 Blackhawks sat on the roof above them, and somewhere upstairs Harold Sims was either alive or not alive, depending on what Dr. Ferris had done in the last 6 minutes, and in another room she didn't even know about yet, a patient was dying. "Who is it?" she asked. Rourke didn't hesitate. Staff Sergeant Marcus Webb. He was extracted from a forward operating position 72 hours ago with a penetrating chest injury. He was stabilized for transport and admitted here under a non-military cover ID because this was the closest facility with trauma capacity. He's been declining for the past 14 hours. "Who's his attending here?" Something shifted in Rourke's expression. "Careful." "Dr. Victor Langford." Emily looked at him for a long moment. "Take me up," she said. The elevator ride to the 4th floor happened fast and without conversation. Rourke's team reorganized around them without being told. 2 personnel held the lobby, 2 went for the administrator. The rest moved with Rourke and Emily toward the stairwell because the elevator was too slow and Rourke was already on comms saying, "We have Valkyrie, moving to the unit now, prep the room." They came out of the stairwell into the 4th floor corridor, and Emily immediately clocked the 2 men in civilian clothes outside room 412, who were very clearly not civilians, and the monitoring equipment visible through the window that was showing numbers she didn't like. She pushed through the door. Marcus Webb was 31 years old, according to what Rourke had told her on the stairs, and he looked 10 years older than that right now. He was lean in the way people get lean when their body has been consuming itself for fuel, and there was a gray undertone to his skin that she recognized before she even pulled up his chart. His breathing was labored, short, compensatory respirations with the accessory muscles working too hard, the kind that meant his primary mechanics were compromised. She pulled up the chart on the bedside terminal and read it in the focused, rapid way she'd been trained to read. Not beginning to end, but key values, trending data, nursing notes, physician orders. What she found made her jaw tighten. He had a penetrating left chest wound from the extraction injury. The admission notes documented it, the imaging confirmed it, and the treatment plan, Langford's treatment plan, had addressed it with a chest tube and IV antibiotics, and the kind of conservative management that made sense for a patient who was stable and trending toward recovery. Marcus Webb was not stable. Marcus Webb had not been stable for at least 12 hours, and the nursing notes, 3 separate notes from the night shift nurses, documented a slow but clear deterioration in breath sounds, increasing respiratory effort, and a blood pressure that had been quietly sagging for the past 8 hours. There was no escalation note from Langford, no re-imaging order, no reassessment. Emily had been right about Harold Sims, and she was right about this too, and the difference was that this one was younger and had a penetrating injury and had significantly less time. "When was the last imaging?" she asked without turning around. "Admission," one of Rourke's personnel said from the doorway. "That was 36 hours ago." "Yes." She leaned over the bed. "Marcus." She put her hand on his forearm, not gently, exactly, but with the specific intentional pressure of someone telling another person's body that they're not alone. I'm Emily Carter. I served with the 75th Medical Attachment. Someone told me you were asking for me." His eyes opened. They were dark and exhausted, and underneath that, very focused. "Valkyrie," he said. It came out quiet and rough. "Yeah." She squeezed his arm. "I'm here. I need you to stay with me, okay? I'm going to figure out what's happening and I'm going to fix it, but you have to stay awake." He nodded. Small movement. It cost him something. She straightened and looked at Rourke in the doorway. "I need a portable ultrasound in here in the next 3 minutes. I need a full surgical tray on standby. I need someone to find me a thoracic surgeon who is not Victor Langford, or I need to know now if I'm doing this without backup." "You're not a physician," one of Rourke's men said. "No," she said, "I'm not. I'm a former special operations combat medic with 12 years of field surgical experience, 3 overseas deployments, and a case record that includes 6 successful emergency thoracic interventions without a surgical team present." She looked at him directly. "Your commanding officer called me by my call sign. I'd like to start." The man looked at Rourke. Rourke said, "Get her the ultrasound." Behind Emily, the door opened. She heard the specific quality of the silence that entered the room before the person spoke, and she turned. Dr. Victor Langford stood in the doorway of room 412 in his pressed white coat with 2 administrators behind him, and he looked at the tactical personnel and the monitoring equipment and the woman standing at the bedside of his patient, whose chart he had not reviewed since 8 p.m. the previous evening, and his face moved through several expressions before settling on the one he defaulted to when he was challenged. Authority. "What the hell is going on in my unit?" he said. Rourke turned to look at him with the kind of calm that doesn't require raising its voice. "Dr. Langford, I'm Commander Dale Rourke. This patient is under federal status. I need you to step outside." "This is my patient and my unit." "Was," Emily said. Langford looked at her. The word had come out flat and quiet, and she hadn't inflected it as a question or a provocation, just a correction, like adjusting a data entry. "You're supposed to be off this floor," he said. "A lot of things are supposed to have happened," Emily said. "Most of them didn't. This man has been reaccumulating hemothorax for at least 12 hours, and there's no evidence anyone ordered a reassessment. His chest tube output stopped 6 hours ago. Either it's blocked, or the bleeding has been tamponating, and the pressure has been building." She kept her voice level. "He needs imaging now, and intervention within the hour." "You are not qualified to make that assessment." "She's more than qualified." Rourke's voice hadn't changed in volume or temperature. "I'd ask you again to step outside, Dr. Langford. We can have a full conversation about jurisdiction and documentation in the hallway. Right now, I need this room cleared for the person who is actually going to help this patient." Langford didn't move immediately. He stood there with his hands very still at his sides, and Emily watched him look at the monitoring equipment, and at Marcus Webb's face, and at her, and she saw the moment he did the calculation. The calculation being not what is the right thing to do, but what can I survive here? And he took one step back, then another. The door closed behind him. Emily turned back to the bed. The portable ultrasound unit was already being wheeled in by a respiratory tech who looked like she wasn't sure what she'd walked into. Emily didn't explain. She took the probe, applied gel to Marcus Webb's left chest, and started the scan, and within 40 seconds she had the image she'd been looking for and dreading simultaneously. The left pleural space was full. Not partially. Full. Clotted hemothorax pressing the lung completely flat, the mediastinum shifting right, the heart visibly working against the pressure. The chest tube was clotted. Had been for hours. None of it was draining. "We have a retained hemothorax and tension physiology developing," she said. "I need the surgical tray now." "The on-call surgeon is 4 minutes out," Rourke's officer said from behind her. 4 minutes is acceptable if someone's monitoring his pressure every 30 seconds and has a 14-gauge needle ready in case he decompensates before we can get the room set up. She looked at the respiratory tech, who was a young woman, maybe 25, who was watching Emily with an expression that had moved past confusion into something sharper. "Can you do that?" "Yes," the tech said. No hesitation. "Good." Emily moved to the supply cart. "Then let's keep him alive until the surgeon gets here." Down the hall, the door to the administrator's conference room had been opened, and inside it, Commander Dale Rourke was laying a folder on the table in front of the hospital's chief operating officer and 2 department directors, and the folder contained documentation that nobody in that room was going to enjoy reading. And in room 14, 2 floors below, Harold Sims, the veteran Emily had spent 3 hours trying to protect, had been decompressed by Dr. Ferris 6 minutes after Emily left, responding to exactly the signs she'd described, and was now breathing on his own with a chest tube in place and a pulse that was coming back from the edge it had been standing on. He didn't know yet who had been fighting for him all night. He didn't know the woman who'd stayed at his bedside had been dragged out of his room while his heart was stopping. He didn't know her name. But somewhere in the 4th floor of Redstone Regional Medical Center, while a military surgeon was scrubbing in and Commander Rourke was spreading evidence across a conference table and 3 Blackhawks sat on the roof like a reckoning that had been a long time coming, Emily Carter was pulling on sterile gloves over the hands that had never really stopped knowing exactly what to do. The OR attending arrived at 7:04. He took one look at the ultrasound image Emily had already annotated on the screen, looked at Emily, looked at Rourke's personnel filling the doorway, and made a decision. "Talk me through what you're seeing," he said. Emily talked. He listened. And for the first time in 6 hours, the room felt like it was moving in the right direction. Marcus Webb was not out of danger. But for the first time since he'd been admitted to Redstone Regional under a name that wasn't his, someone was treating him like his life was the only thing that mattered. Down the hall, Victor Langford stood with his back against the corridor wall, watching the activity in room 412 through the narrow window in the door, and the expression on his face was not one he would have wanted anyone to document. His phone buzzed. He looked down. It was an email from hospital administration flagged urgent. The subject line read, "Formal inquiry, patient safety incident review. Dr. V. Langford." He read it twice. Then he put his phone in his coat pocket and stood very still in the corridor, while around him the hospital moved and breathed and people walked past without looking at him, and the 3 helicopters on the roof above him sat there like a weight that wasn't going anywhere. The OR attending's name was Dr. Samir Okafor, and he was the kind of surgeon who didn't waste time performing confidence for a room. He either had it or he didn't, and right now, standing in room 412 with Emily Carter talking him through a retained hemothorax case that should have been caught 18 hours ago, he had it. "Left-sided," he said. "Completely collapsed. Mediastinal shift is already happening." Emily kept her voice even. "The tube's clotted through. I don't think it's been draining since somewhere around 0100. Okafor pulled on gloves and took the ultrasound probe from her and confirmed what she'd already shown him in about 20 seconds. He set the probe down. He didn't look at her with the expression she'd gotten used to at this hospital, the one that said, "Who are you and why are you talking?" He just nodded once, short and efficient, and turned to the nurse who'd come in behind him. "Get me a thoracic setup. Tell the OR we may need a room in the next 30 minutes if this doesn't drain adequately with tube replacement." He looked at Emily. "Walk me through the timeline." She did. Not the emotional version. She gave him the clinical version, timestamps and numbers. The output logs that showed the tube had stopped producing at 1:17 a.m. The nursing notes that had documented the respiratory decline without triggering a reassessment. The 12-hour gap between Langford's last documented evaluation and this moment. Okafor listened without interrupting, which told her he was actually listening and not just waiting for her to stop talking. When she finished, he was quiet for a moment. "You're the nurse who flagged Sims on the 2nd floor," he said. "Yes." "Langford had you removed." "Security escorted me out during the code, yes." Okafor looked at Marcus Webb's face, gray and exhausted, eyes closed now, chest moving in those shallow compensatory breaths, and something moved through his expression that wasn't quite anger, but was in the same territory. "All right," he said, "let's get this tube replaced. You're staying in this room." It wasn't a question. Emily didn't treat it like one. The next 40 minutes were the kind that collapsed time in a way she remembered from deployment, not fast exactly, but compressed, where each action was so sequentially necessary that there was no space between them for anything that wasn't the next step. Okafor replaced the chest tube with the efficiency of someone who'd done it hundreds of times. and when the new tube was in and the suction connected, the drainage that came back was immediate and significant. Dark, partially clotted blood that had been sitting in Marcus Webb's pleural space long enough to cause the kind of pressure physiology that killed people quietly. "There it is," Okafor said, not triumphant, just acknowledging. Marcus Webb's oxygen saturation began climbing within 4 minutes. 86 to 89 to 92. His breathing changed, still labored, still not where it needed to be, but the desperate quality left it, the way a person's posture changes when they've been leaning against a wall they didn't know was there, and someone finally takes the weight off. His eyes opened. He found Emily's face across the room. She crossed to the bedside. "Still here," she said. He moved his lips. She leaned closer. "Told them," he said. "Told them to find you." His voice was wrecked, hoarse and slow, but his eyes were sharper than they'd been when she'd first walked in. "Didn't think they'd actually do it." "Neither did I," she said honestly. Something that might have been the beginning of a smile crossed his face. It didn't fully make it because it cost too much, but the intention was there. Okafor was documenting at the bedside terminal, and one of Rourke's personnel had stepped out to relay the update, and for a moment the room was as close to quiet as it had been since Emily arrived. She stayed at the bedside, didn't let go of Marcus Webb's wrist, not monitoring his pulse exactly, just maintaining the contact. She'd learned a long time ago that conscious patients in serious condition needed 2 things from medical personnel: competence and the physical confirmation that someone was still there. The second one was underrated. People in bad shape could feel when a room had emptied of attention, even when their eyes were closed. She'd learned that in places where the alternative to someone staying was a body bag. Down the hall, the situation was developing differently. Commander Rourke had spent the past 40 minutes in the conference room with the hospital's COO, a woman named Patricia Heald, who wore her composure the way some people wore armor, as protection, not decoration. Across from her, 2 department directors had been largely silent since Rourke had opened the folder. The folder contained a great deal. Rourke had the kind of institutional patience that came from running operations where being angry before you had all the information was a tactical liability. He laid out what he had methodically: Marcus Webb's admission records under the cover identity, the documented deterioration, the nursing notes that showed 3 separate flags from overnight staff that had not resulted in a physician reassessment, and a timeline that placed Langford's last documented contact with the patient at 8:07 p.m. the previous evening. It was now 7:51 a.m. That was 11 hours and 44 minutes for a post-extraction penetrating chest wound. "We need to understand the full context before," one of the directors started. "I understand the context," Rourke said. "What I need to understand is your hospital's process for escalating nursing concerns to senior physicians, and whether that process was followed here, and if it was followed and still produced this outcome, what that tells us about the process." Heald had been looking at the folder. She closed it. "You mentioned a second patient. Harold Sims, room 14, second floor, Army veteran, admitted 2 days ago. The same nurse who identified the deterioration in Sergeant Webb's case had been flagging Mr. Sims since 2300 last night. She was removed from the floor during his code at 0647 this morning." Heald's expression didn't change, but the quality of her stillness did. "Where is she now?" "4th floor, with Sergeant Webb and Dr. Okafor." The director who'd started to object earlier was now looking at the table. The other one, a man named Fredericks who'd said almost nothing since Rourke arrived, cleared his throat. "What does the military want from us, Commander?" Fredericks said. It wasn't hostile. It was the question of someone trying to locate the edges of a situation that kept expanding. "Right now, cooperation with the ongoing case review, access to documentation, and a clear answer about who made the decision to remove Nurse Carter from active patient care during an active code." Rourke folded his hands on the table. "After that, we'll see what the investigation determines." "Investigation," Heald said. "Sergeant Webb is active duty special operations personnel who was admitted to your facility under federal status. His medical care falls under the oversight jurisdiction of the DoD Medical Inspector General's office. I activated that review at 0610 this morning before we had confirmed Nurse Carter's location. He paused. You'll be receiving formal documentation within the hour. Heald looked at him for a long moment. I'd like to speak with Dr. Langford, she said. So would I, Rourke said. I've been told he's in the building. He was. Langford had not left. That was the thing about Victor Langford that people who didn't know him well might not have predicted. He was not the type to run. Running implied guilt, and Langford had spent 20 years constructing an identity around the premise that he did not make mistakes that required running from. What he was doing instead was standing in the second-floor corridor near the nurse's station with his phone in his hand, making calls. The first call had been to the hospital's legal counsel. The second had been to a colleague at another facility, a man who owed him a professional favor and who Langford wanted on record as someone who could speak to his clinical judgment. The third was to the staffing agency that placed Emily Carter, which was how he'd spent 11 minutes of his morning, trying to determine whether her removal from the building could be completed before the military's presence in the hospital became a formal institutional event rather than an operational one. The staffing agency's on-call manager had told him, carefully and with the specific verbal caution of someone who had just looked at something on a screen that was making them uncomfortable, that they would need to consult with their legal team before taking any further action regarding Miss Carter's placement status. Langford had ended that call and stood for a moment in the corridor processing what the morning had become. He'd handled difficult situations before. He'd handled complaints and incident reports and one previous peer review that had gone nowhere because he was meticulous about documentation and because his outcomes were, on paper, excellent. He knew how to operate within institutional systems because he understood that institutional systems protected the people who kept them running. And he had always been a person who kept things running. What he hadn't calculated for was the variable currently sitting on the roof of his hospital. He was still recalibrating when Dr. Ferris appeared from the direction of the elevator. Ferris was 29 years old, a second-year resident who had been on this floor since 4 a.m. and who had spent the last hour not entirely sure how to process what he'd been part of. He'd decompressed Harold Sims' chest 6 minutes after Emily Carter had been walked out of the room, and Harold Sims was alive because of it, and Emily Carter had told him exactly what to look for before the security guards had taken her, and he had looked for it and found it and acted on it. And the attending had arrived afterward and reviewed his documentation and told him he'd done good work. He had done good work. He'd been thinking about that and about the person who'd set him up to do it. Ferris stopped when he saw Langford in the corridor. Langford looked at him. How's the patient in 14? Stable. Transferred to the unit about 20 minutes ago. Ferris paused. Chest tubes draining well. He's responsive. Good. Ferris didn't move to leave. Is there something else? Langford said. I documented everything, Ferris said. His voice was careful, not confrontational, more like someone testing the ground before they put full weight on it. The timeline, the handoff I received from Nurse Carter, what she told me before she left the room. That's appropriate. Documentation is, I also documented the time she first paged you. The record shows she contacted you at 0123 and you returned the call at 0123. The call lasted 4 minutes. Ferris was looking at him without looking away, which was the part Langford noticed. Mr. Sims was already showing tracheal deviation at 0430 per the nursing note. There was no physician reassessment ordered after that. Ferris, I'm just telling you what's in the chart. He wasn't being aggressive. He sounded almost apologetic, except that he also didn't stop. Because if anyone asks me about the timeline, that's what I'm going to say. I don't think I have a choice about that. Langford looked at him for a long moment. No, he said finally. You probably don't. Ferris gave a small nod and walked back toward the nurse's station, and Langford watched him go, and the phone in his pocket buzzed again with an email from Patricia Heald's office requesting his immediate presence in the fourth-floor conference room. He read it twice. Then he started walking. In room 412, Emily was standing at the window when Okafor came and stood next to her. Marcus Webb was sleeping. Actual sleep now, not the ragged unconsciousness of oxygen deprivation. And his saturation was holding at 96, and his pressure had come up 8 points. The OR was on standby, but Okafor thought they could manage without going in if the drainage continued and his vitals held overnight. "You want to tell me why you're a float nurse?" Okafor said. Emily looked at the window. "Because I applied to be a float nurse." "That's not what I asked." She was quiet for a moment. "I needed something that didn't follow me home, something I could be good at without it costing me everything every single time." She paused. It didn't entirely work, but it was the right idea. Okafor considered that. "You have more surgical field time than half the attendings in this building." "I don't have a medical degree." "No." He looked at Webb. "You have something else." She didn't answer that because she'd never been good at accepting that category of statement, and she wasn't going to start now. The door opened behind them. One of Rourke's officers, the younger one, the one with the tablet, stepped in and looked at Emily. "Commander wants you in the fourth-floor conference room when you have a minute." Emily turned to Okafor. "Go," he said. "I've got him." She found Rourke in the conference room with Patricia Heald and Fredericks, and a woman she didn't recognize who turned out to be the hospital's legal counsel. Langford was not there. She registered that, noted the significance, and sat in the chair Rourke indicated. "Mr. Sims and Sergeant Webb's cases are both stable," Rourke said, for the room as much as for her. "I want to go back to last night. Walk me through what you documented and when." Emily walked them through it. Heald asked 2 questions, both precise, both suggesting she'd already read the nursing notes carefully. The legal counsel took notes. Frederick said nothing. When Emily finished, the room was quiet for a moment. "Dr. Langford authorized your removal from the floor during an active code," Heald said. "It wasn't a question. She said it the way you say something you've been looking at for 20 minutes and needed to say aloud to confirm it was real." "Yes," Emily said. "Who gave security the instruction to enter the room?" "The charge nurse told me Langford had called down. The guards told me it was authorized by the department chief." Heald wrote something on the notepad in front of her. Rourke slid a single page across the table to Emily. "I need you to review this and confirm the timeline is accurate. This is going into the formal incident report that goes to the DOD Medical IG." Emily read it. It was accurate. She said so. "There's something else," Rourke said. He looked at her directly. "Langford reached out to your staffing agency this morning trying to expedite your termination. He made 3 calls. The agency's on-call manager flagged it to their legal team and to us because your file has the federal protection notation." The legal counsel looked up from her notes. "The notation isn't punitive," Rourke said, answering the unasked question. "It's a standard attachment to the records of personnel who've worked with classified medical programs. It triggers an automatic review of any adverse employment action." He paused. "Which means Langford's attempt to terminate you this morning has been logged as a federal employment matter." Emily sat with that for a second. She hadn't known about the notation. She'd known it was possible. When she'd separated, her discharge paperwork had mentioned something about records management and a review flag, but the JAG officer who'd processed her out had made it sound like a formality. Something about classified contact protocols. Apparently it was less of a formality than advertised. "What does that mean for me?" she said. "Right now, it means he can't complete the termination without a federal review that his hospital's legal team is not going to want to trigger." Rourke glanced at Heald. "I think administration may have some views on that as well." Heald met Emily's eyes for the first time since she'd entered the room. "Your employment status is not in jeopardy," she said. It came out slightly stiff, the way institutional acknowledgments do when they are arriving later than they should have. "I want to be clear about that." Emily didn't say thank you. She nodded. There was a difference. Rourke wrapped up the meeting with a summary of the next steps, the formal investigation timeline, the documentation requests, the process by which the military's medical IG would interface with the hospital's internal review. It was thorough and systematic, and Emily sat through it and answered the questions directed at her and kept her face neutral. What she was actually thinking about was Langford's face in the doorway of room 412 that morning, the calculation she'd seen him do, the moment he'd assessed the room and decided to take one step back. She'd watched men make that calculation before. In her experience, the ones who stepped back once were not the ones who stopped. The meeting ended. Heald and Fredericks moved toward the door. The legal counsel was already on her phone. Rourke stayed behind. When the room was empty, he looked at Emily across the table. "He's going to try to manage this," Rourke said. "Langford. He's already called legal. He's going to position this as a miscommunication, argue that the nursing documentation was incomplete, say the clinical picture wasn't clear. He has 20 years and a reputation, and he's going to use all of it." "I know," Emily said. "The IG investigation is going to take time, weeks, maybe more. In the meantime, he's still in the building." "I know that too." Rourke was quiet for a moment. "Sergeant Webb told me something when we were prepping the extraction. He was cognizant for about 40 minutes before the transport drugs kicked in, and he was worried about what would happen when we got him to a civilian facility." He looked at the table. He said, "If it gets bad, find Valkyrie. She doesn't let people die on paperwork." Emily looked out the window at the parking lot below. The morning had resolved into a gray, ordinary Tuesday. Cars pulling in. A food truck setting up near the employee entrance. The completely normal landscape of a place where something serious had happened and was still happening, and the outside world had no idea. "How long did you serve?" she said. 18 years, 6 with SOCOM. "You ever have a moment where you thought the thing you were good at was going to end up being the thing that found you again?" Rourke considered the question seriously, which she appreciated. "Every time I try to take leave," he said. She almost smiled. Almost. She got up from the table. She had patients to check on. Sims on the second floor, Webb on the fourth, and whatever other assignments the charge nurse decided to give her now that her removal had been reversed. She had documentation to complete. She had an incident report to finalize. She was at the door when Rourke said, "Carter?" She turned. "The investigation is going to want a statement from you about your military credentials. Your full service record." He paused. "It's going to become part of the formal file, which means it won't be quiet anymore." Emily stood in the doorway for a moment. 3 years of invisible. 3 years of building something small and contained in hers. A studio apartment with plants that were mostly alive. A 6-year-old car with a cracked dashboard. A standing order at the coffee cart near the employee entrance. And a version of herself that nobody tried to deploy. "I know," she said. She walked out into the corridor. It took her 4 minutes to get to the second floor. Harold Sims was in a room at the end of the hall now, transferred from room 14 to a monitored bed in the step-down unit. He was awake. His color was better than it had been at 6 a.m. by a margin that would have been visible to anyone, not just someone who'd been watching him through the night. He looked up when she walked in. "You're the one," he said. His voice was still rough from the tube. "The night nurse. They told me." He stopped and cleared his throat. "They told me you wouldn't stop." "How are you feeling?" Emily said. "Like someone put a garden hose in my chest." He tried to shift and thought better of it. "But breathing, so." "That counts," she said. He was looking at her in the way people looked when they'd been told something and were trying to match the information to the person in front of them. "They said you were a military medic. Before." "Before," she agreed. "My son's army," he said. "Fort Bragg." Emily pulled the chair beside the bed and sat down. Not because she had time to sit, she had 2 pending assessments and a medication reconciliation to complete, but because this man had a chest tube and had coded 4 hours ago and was trying to tell her something, and some things were worth the 4 minutes it took to hear them. "The nurse they were walking you out," he said slowly. "I heard the alarm. Then I heard the commotion in the hallway." He paused. "I figured out what happened after. The resident told me." Emily didn't say anything. "You were in the room when it happened," he said. "You were doing compressions. Dr. Ferris finished the code. After you set him up to finish it." Sims looked at her. His eyes were tired and very clear. "I've been in the military for 28 years. I know what it looks like when someone does their job and doesn't get credit for it." Emily looked at the monitoring equipment. His heart rate was 72, steady. "You should get some rest," she said. "I know," he said. But he didn't look away. She stood to leave, and she was at the door when his voice followed her out. Quiet, deliberate, the kind of voice that had given orders and received them and knew the weight of both. "Thank you," he said, "not for saving my life. I know you're going to say Ferris did that." He paused. For the 3 hours before, when you didn't stop. She stopped in the doorway. She didn't turn around because if she turned around, she was going to have to say something, and she didn't have anything that fit. She walked out. The corridor outside was moving again. Nurses shifting between rooms, a transport aide pushing an empty wheelchair, the ordinary machinery of a hospital morning. Emily took the long way back to the nurses' station, past the window at the end of the hall that looked out over the roofline, and she could see from here that 2 of the 3 Blackhawks had repositioned, 1 still on the pad, 2 moved to the adjacent athletic field of the school across the street. They hadn't left. She stood there for exactly 12 seconds, which was how long it took for her to register that doctor. Ferris was standing at the nurse's station with his resident badge clipped at a slightly crooked angle and a styrofoam cup of coffee he hadn't touched, and an expression that looked like someone who'd been carrying something heavy since 700 and wasn't sure where to set it down. She walked over. He looked up. "Hey." "Hey," she said. "He's stable. Sims." He said it like she might not know, like he needed to report it to her specifically. "I know, I just saw him." Ferris nodded. He turned the coffee cup in his hands. "I documented the handoff," he said. "What you told me, the signs you identified, all of it. I saw the chart. I wanted you to know it's in there, accurately, with your name and the time." She looked at him. He was young. Younger than she'd initially registered, with the specific uncertainty of someone who was good at the work and not yet sure what the work was going to cost him. He'd done the right thing this morning in a room where doing the right thing had required him to move faster than his attending had told him to, and he was still standing in the corridor at 8:30 a.m. processing it. "You did good in that room," Emily said. He looked away. "You set it up. You still had to do it." He didn't argue, but he didn't look particularly comforted either. He looked like someone who'd just understood that a single morning could permanently reorganize the way they saw the institution they'd chosen to work inside, and that once you saw it, you couldn't go back to not seeing it. Emily understood the feeling. She was about to say something else when her phone buzzed. She looked down. It was a text from a number she didn't recognize, which she was about to ignore when she saw the first 3 words and stopped. "Langford is meeting." The text cut off mid-sentence. Then a second message came in from the same number. "With the board chair. Private. Started 10 minutes ago. You should know." Emily looked at the screen. Unknown sender. She didn't recognize the number, but the message was formatted with a timestamp and a room number. Admin suite, 3rd floor, room 304. She turned the phone over in her hand. Someone inside this hospital had just chosen a side, and they'd chosen it quietly, the way things get done when the stakes are high enough that people stop wanting their names attached. She looked back out the window at the roofline. The one remaining Blackhawk sat on the helipad. Still. Engines off now, rotors motionless, not going anywhere, just present. Emily started walking toward the elevator, and she did not look like someone who'd been awake for 22 hours, and she did not look like someone who'd been escorted toward an exit 4 hours ago by 2 security guards. She looked like someone who had just received information about a meeting she intended to make relevant. The elevator arrived. She stepped in. The doors closed. And somewhere on the 3rd floor of Redstone Regional Medical Center, Victor Langford was sitting across from the board chair with a legal pad and a 20-year reputation and a story he was still in the process of deciding how to tell. Not yet aware that 3 floors down, the woman he'd been trying to remove from the building since last night had just been handed the room number. The 3rd floor of Redstone Regional Medical Center was quieter than the others. Administrative quiet. The specific hush of carpeted hallways and closed doors, and people who communicated through assistants and email rather than across nursing stations. Emily had been up here twice in her 8 months at this hospital, both times for onboarding paperwork, and she knew the layout the way she knew most things, functionally, without attachment. Room 304 was at the end of the east corridor, past the HR suite and a small waiting area with chairs that looked like they'd never been sat in. The door was closed. No window. She stopped 6 feet from it and stood there and thought about what she was doing. She was a float nurse with no badge, no documented authority, 22 hours without sleep, and a text from an unknown number pointing her at a closed-door meeting between the man who'd tried to end her career and the person who had the institutional power to let him. She had no standing to walk into that room. She had no legal right to the conversation happening behind that door. What she had was a timeline, a documented record, and the specific clarity that came from having nothing left to protect except the thing that had always actually mattered. She knocked. Silence. Then movement. The door opened, and a woman Emily didn't recognize, mid-50s, sharp eyes, the kind of suit that didn't come off a rack, looked at her with an expression that was calibrated to discourage further progress. "This meeting is private," the woman said. "I know," Emily said. "I'm Emily Carter. I'm the nurse Dr. Langford had removed from the floor during an active code this morning. I have a federal incident report filed against this facility and a DoD Medical Inspector General review that was activated approximately 3 hours ago." She kept her voice even. "I think I should be in this conversation." A beat. The woman glanced back into the room. "Let her in," said a voice from inside. The woman stepped aside. The room was a mid-sized conference space. Oval table, 6 chairs, a credenza with a coffee setup that hadn't been touched. Victor Langford was seated on the far side of the table with a legal pad in front of him and a posture that communicated a kind of aggressive composure, the posture of a man who'd decided that the best position to defend was the one he'd always occupied. Across from him sat a man Emily placed at around 65, heavy-set, silver-haired, with reading glasses pushed up on his forehead, and the kind of stillness that came from running things long enough that being surprised was no longer part of his operating range. This was the board chair. The woman who'd opened the door took a seat at the near end, which meant she was legal counsel. Not the hospital's general counsel. Someone different. Someone Langford had brought. Emily sat down without being invited to. Langford looked at her the way he'd looked at her in the hallway 14 hours ago, with the specific controlled contempt of someone who had decided she was a problem to manage rather than a person to address. "This is a private administrative meeting," he said. "You have no standing here. The DO makes me a material witness to the events under review," Emily said. "I have standing. That investigation hasn't been formally opened yet. The activation was logged at 0610. I have the documentation. She didn't take it out. She didn't have it on her. It was on her phone, which she wasn't going to use as a prop. But she knew the timestamp, and she said it the way she said clinical data, which was without decoration. Commander Rourke filed the initiation paperwork before we confirmed Webb's condition this morning. It's already in the system." The board chair, whose nameplate on the credenza read Gerald Mast, Chairman, Board of Directors, had been looking at Emily since she walked in. He had the reading glasses down on his nose now, and he was looking at her over them. "Miss Carter," he said, "I've been hearing your name all morning." "I've been having a long morning," Emily said. Something shifted at the corner of his mouth. Not quite a smile. "Sit down, both of you." He looked at Langford when he said the second part. Langford was already sitting, but the instruction flattened something in his posture, barely visible. Emily catalogued it. Mast took off his glasses entirely and set them on the table. "Dr. Langford has been presenting his account of the events over the past 18 hours. I'd like to hear yours. Uninterrupted." He looked at Langford's counsel. "From everyone." Emily gave it to him in 4 minutes. Not the emotional version, not the abbreviated version, the complete clinical timeline in order, with the documentation reference numbers she'd memorized from the chart entries she'd filed throughout the night. She didn't frame it. She didn't characterize Langford's behavior. She reported what she had observed, what she had documented, what she had communicated to whom and when, and what the patient outcomes had been. She spoke the way she'd been trained to debrief: facts, sequence, consequence. When she finished, the room was quiet. Mast was looking at his notepad. He'd written 2 things on it, neither of which Emily could read from where she was sitting. Langford's counsel said, "Miss Carter's documentation reflects her subjective interpretation of a clinical situation that the chest tube stopped draining at 0117, Emily said. "That's not subjective, that's in the output log. The output log reflects recorded measurements at scheduled intervals. It doesn't. The nursing note at 0130 documents decreased breath sounds on the left and increased respiratory effort. That's in the chart, written by the night nurse, not by me." Emily looked at the counsel, not at Langford. I'm happy to go through every entry individually if that's useful. Mast held up a hand. Not dismissively. It was a stop, I'm thinking gesture, and it landed on the room like a pause button. He looked at Langford. Victor, he said, when did you last physically assess Mr. Webb? The specific use of the first name was not accidental. Emily watched Langford register it. I reviewed his chart at physically assessed, in the room. A pause. Small, but present. I had reviewed his imaging and his chart data, Langford said. The clinical picture at my last assessment was consistent with expected post-extraction recovery. The nursing notes that came in overnight indicated fluctuation within a range that didn't trigger. When? Mass said. Another pause. Longer. My last in-room assessment was at 207 hours, Langford said. Mass wrote something on his notepad. And between 2007 last night and when Commander Rourke's team arrived this morning, I responded to pages and reviewed updates remotely. How many pages? Langford glanced at his counsel. The counsel said nothing. I would need to review my call log, Langford said. Mast nodded. Once. Slow. He set down his pen and looked at Emily. Miss Carter, Dr. Okafor's preliminary note is indicating that Sergeant Webb's condition was consistent with a developing tension physiology pattern that had been progressing for approximately 12 hours before intervention this morning. That's consistent with the output data and the nursing notes, Emily said. In your assessment, and I'm asking for your clinical judgment here, not a legal statement, could that progression have been identified earlier? Emily looked at him. She knew what the question cost him to ask, and she knew what her answer was going to cost everyone in the room. She also knew that Harold Sims had a chest tube because she hadn't stopped, and Marcus Webb was alive because Okafor had listened. And the only variable in both cases that had worked against the patients was the assumption that she didn't know what she was talking about. Yes, she said, it could have been identified earlier. The indicators were present and documented. They required a physical assessment to act on. Mast closed his notepad. Langford said, Gerald, I'll need your department access suspended pending the review, Victor. Mast said it the way people say things when they've made a decision before the conversation started, and the conversation was confirmation rather than deliberation. That's not punitive. It's procedural. You know that. The air in the room changed. Langford's counsel put her hand on the legal pad in front of her, which was the physical equivalent of clearing her throat. Mr. Mast, any suspension action taken prior to completion of a formal review creates significant liability either way, Mast said. I know. He looked at Langford. Victor, I've known you for 17 years. I need you to hear me when I say that the next thing that matters is not your reputation. It's what's in that chart. Because if what's in that chart is what I'm being told it is, then this conversation is the easy version of the ones that are coming. Langford sat very still. Emily had watched people receive information that rearranged their world before, in field situations, in emergency rooms, in corridors outside trauma bays. There was a specific quality to the stillness that followed, and Langford had it now. The quality of someone who had been doing math in their head and arrived at an answer they didn't like. He pushed back from the table. I need to speak with my counsel privately. Of course, Mast said. Emily stood. She followed Mast out of the room, and Mast's assistant materialized from somewhere and took him toward his office. And Emily stood in the hallway outside room 304 and exhaled slowly through her nose and took stock of what had just happened. She had walked into a closed meeting with no invitation and no formal standing and had delivered a clinical timeline to the man with the authority to act on it, and he had acted on it, and Langford's department access was being suspended, and she was standing in the carpeted hush of the third floor at 9:07 a.m., having been awake for nearly 23 hours. Her hands were steady. She noticed that. Steady the way they'd always been when there was work to do, and the situation had passed from the terrible uncertainty stage into the stage where things were simply happening and her job was to move inside them. Her phone buzzed. Rourke. Webb's pressure spiked. Okafor is managing but wants you in the room. 4th floor now. She was already walking. The 4th floor was different from the 3rd in every possible way. Noise and motion, the controlled chaos of acute care, monitors and carts, and the smell of antiseptic that had soaked into the walls over years of use. Emily pushed through the door from the stairwell and was at room 412 in 40 seconds. Okafor was at the bedside. 2 nurses, a respiratory therapist. Marcus Webb was awake, and that was the first thing Emily confirmed because it was the most important data point. Awake meant conscious. Conscious meant oxygenating. Oxygenating meant whatever was happening wasn't yet catastrophic. Pressure spiked to 168/94, then dropped to 88/60 over 12 minutes, Okafor said without preamble when she appeared. He's been oscillating. Drainage looked good, and then output dropped again. Different tube, same side. Emily moved to the bedside and looked at Webb directly. Marcus, any chest pain? Pressure, he said. Not quite pain. The distinction mattered. Left or right? Left. And... He stopped, pressed his lips together. Down, left arm. Emily and Okafor looked at each other simultaneously. How long? She said. Started, maybe 20 minutes ago. Before or after the pressure spike? He thought about it. His face was tight with the effort of being precise when he didn't feel precise. Before. I think before. Emily looked at the monitor. His pressure was 94/61 right now and coming down. His rate was elevated, 108. He was diaphoretic. She could see the sheen on his face. The arm pain was left-sided. The pressure was oscillating rather than trending clean. In a 31-year-old with a recent penetrating chest wound and a 12-hour retained hemothorax and a chest tube that had now dropped output twice. We need a stat echo, she said. Already ordered, Okafor said. 12 minutes out. If this is a cardiac contusion with delayed arrhythmia presentation, I know. Or a dissection that started with the Emily. He said her name to stop the list, not because she was wrong. I know. We're moving. She nodded. She pulled a stool to the bedside and sat. Not because she intended to stay out of the way, but because Webb's eyes had found her and he was holding on with them the way people held on when the room was full of people moving fast and they needed one fixed point. Hey, she said. Am I dying again? He said. The delivery was dry enough that it might have been a joke if his face hadn't been gray. Not if I can help it, she said. You've got a dissection we're watching or a bruised heart throwing a tantrum. We're figuring out which. Great options. I've worked with worse. He exhaled, short and careful. You look terrible, he said. I've been here since yesterday. Why? She looked at him. Same reason you asked them to find me. He was quiet for a moment, then, I didn't think they would, actually. I was in pretty bad shape when they extracted me. I didn't know where I was. I just kept saying your name because... He stopped. Because I'd seen you work in Kandahar. You were attached to us for 6 weeks, and I saw you keep 3 people alive that nobody else thought were going to make it, and when I thought I wasn't going to make it, that's the name my brain gave me. Emily sat with that. You were in the 3rd Ranger Battalion rotation, she said. 2019. Yeah. She'd been 26 that year. She'd deployed with a support attachment to a Ranger unit for 6 weeks in the late summer, and she'd had cases she still thought about. Not all of them good outcomes, but none of them for lack of trying. She remembered the operational tempo. She remembered the particular quality of exhaustion that came from working in a forward position where the gap between casualty and fatality was measured in minutes, and the only thing in that gap was whatever she could do with her hands and her training and the supplies in her kit. She didn't remember Marcus Webb specifically. She'd seen a lot of faces that year, but he remembered her. The echo technician arrived at 9:24. The study took 11 minutes. Okafor read it in 3, which was faster than most attendings could manage, and he straightened up from the screen and said, Cardiac contusion, left ventricular wall, no dissection. Rhythm is borderline. If he tips into VTAC, we go straight to cardioversion. Secondary to the penetrating injury? Emily said. Has to be. The admission imaging showed clean cardiac silhouette, but a contusion this size takes time to declare itself. He looked at Webb. We're going to manage this medically and watch you like a hawk for the next 6 hours. No movement, no excitement, no bad news if we can help it. Too late on the bad news front, Webb said. More bad news, Okafor clarified. Emily stayed in the room while Okafor made the calls. Cardiology consult, medication adjustments, escalating the monitoring frequency. She stayed because Webb's eyes kept coming back to her, and she understood functionally that her presence was doing something that the medication wasn't, which was giving him a fixed point in a morning that had been nothing but movement and crisis. She thought about what Rourke had said, that her service record was going to stop being quiet, that the investigation would surface it, that the version of herself she'd constructed here, the invisible float nurse, was going to become something else, whether she wanted it to or not. She'd built the quiet life deliberately. Not out of shame. She wasn't ashamed of what she'd done or what she'd been. She'd built it out of the specific exhaustion of being good at something that cost everything every time, and the knowledge that if she stayed inside it, she would eventually lose the ability to want anything smaller, anything human-sized. Nursing had been human-sized, rooms and charts and patients, and the particular satisfaction of being useful without being a weapon. She'd been good at it. She genuinely liked it. This morning had not been human-sized. She was still sitting with that when the door to room 412 opened and Commander Rourke came in with a tablet and an expression she hadn't seen on him yet. Not urgent exactly, but waited. "I need you in the hallway," he said. She looked at Webb. He gave her a small nod. "Go." And she followed Rourke out. He pulled up something on the tablet and turned it toward her. It was an email chain. She could see the header formatting, the institutional addresses, the timestamps. She scanned it in the way she read charts. Key information first, context second. The top email was from a Redstone Regional Medical Center administrative address. The second was from what appeared to be a legal firm. The third was from an address she didn't immediately recognize, but Rourke pointed to the domain with one finger, a National Medical Licensing Board. "Langford filed a formal complaint against you with the State Medical Oversight Board 40 minutes ago," Rourke said. "He's alleging that you performed unauthorized medical procedures on a patient, Webb, without physician supervision and without the appropriate credentials." Emily read the relevant section of the complaint. It was 2 paragraphs, and it was precisely worded in the way that legal documents were precisely worded when someone had drafted them in a hurry, but with a great deal of specific intent. It characterized her involvement with Marcus Webb as an unauthorized clinical intervention by an unlicensed practitioner, and it cited the placement of the updated chest tube, which Okafor had placed, not Emily, but which she had been present for and had provided guidance during, as evidence of her overstepping. "Okafor placed the tube," she said. "Yes, the complaint acknowledges that. It alleges that you directed the procedure. I provided clinical information that informed his assessment. That's also in the complaint, framed differently." Rourke took the tablet back. He filed it specifically with the Nursing Oversight Board, not the Medical Board. He's arguing that you exceeded the scope of nursing practice by performing clinical assessment, providing diagnostic conclusions, and directing physician action. Emily looked at the wall. She understood what Langford was doing. He was losing the institutional ground and pivoting to a different kind of attack, one that targeted not his conduct but her credentials, one that could potentially result in her nursing license being flagged while the complaint was under review, which would remove her from the board in ways that the DOD-IG investigation couldn't protect against. Because the IG investigation was about his conduct and the licensing complaint was about hers. It was the move of someone who had assessed the situation and decided that if he was going down, he was going to make sure she came with him. "When does the licensing board act on it?" she said. "They've already sent an acknowledgement. Standard process is a preliminary review within 72 hours. He paused. "In the meantime, your ability to practice in this facility is technically under review. Heald said my employment status wasn't in jeopardy before this complaint. This is a separate mechanism." He said it without apology. Not because he didn't care, but because he was the kind of person who understood that accurate information was more valuable than comfortable information. "Our legal team is looking at it. The federal protection flag on your file may complicate his ability to use this mechanism to remove you, but that determination isn't fast." Emily was quiet for a moment. She was processing the way she processed field situations. Not emotionally first, practically first. What was the ground? What were the actual constraints? What could move and what couldn't? He's doing this from inside the building, she said, while his department access is suspended. His suspension was administrative pending review. It didn't restrict him from using his personal devices. He filed a complaint with a licensing board from his phone while sitting in a meeting with the board chair. That's what the timestamps indicate, yes. She was quiet again. Then, what does the military actually have on him? Documented, formal, enough to put in front of a board. Rourke looked at her steadily. 2 patients with documented deterioration over extended periods without adequate physician reassessment. Nursing notes that show escalating flags that were not acted upon. His own call logs, which we've subpoenaed as part of the IG review, showing contact frequency and duration during the relevant windows. He paused. And a witness list that includes 4 nursing staff, 1 resident, and an attending surgeon. Ferris, Emily said. Among others, the night nurses from Webb's floor documented their concerns in the chart. They both indicated they're willing to make statements. He looked at her. You're not alone in this. She hadn't assumed she was, but it helped to hear it in those specific words rather than the more general reassurances she'd been receiving since the morning started. If the licensing complaint triggers a suspension of my nursing practice while it's under review, she said, I lose the ability to provide a first-hand account as an active clinician. I become a former employee with a pending complaint. That changes how my testimony reads. Yes, Rourke said. It does. She turned and looked back through the window of room 412. Marcus Webb was visible from here. Monitors, the careful stillness of someone who'd been told not to move. Okafor was at the terminal. The room was organized and functional, and Webb was alive in it, and that was the direct result of a chain of events that had started with Emily refusing to leave a hallway the night before. He's escalating because he's afraid, she said. It wasn't a question. People who aren't afraid don't file licensing complaints against material witnesses 40 minutes after their department access is suspended, Rourke agreed. What do you need from me? A formal statement, today, before the complaint goes to preliminary review. Something on the record from you, with timestamps, that establishes the clinical basis for every action you took from 2300 last night through this morning. It won't stop the review process, but it'll be part of what the licensing board sees when they open the file. How long? As long as it needs to be. Emily nodded. Get me a room and a recorder. Rourke was already moving. He had the tablet out, making calls. Emily stayed at the window for another moment and looked at Webb. She thought about the version of herself she'd been trying to be here. Quiet, contained, human-sized. She thought about whether that version was still available to her after today, and she was honest enough to think the answer was probably not, and she was tired enough that the grief of that was distant and small compared to everything that was currently in motion. She was turning to follow Rourke when the elevator at the end of the corridor opened, and what came out of it stopped her mid-step. 2 people. Not hospital staff. She could tell from 15 feet away that neither of them was hospital staff. The man was in his late 40s with a federal ID clipped to his jacket, and the woman beside him was carrying a case that Emily recognized as the kind used for official recording equipment. Behind them, 2 more people in suits, one of them holding a document that she could tell from its format, and the blue government seal on the cover page was not an administrative memo. The man with the federal ID looked at the floor signage, then at his phone, then down the hall toward where Rourke was standing. Commander Rourke? He called. Rourke stopped, turned. Special Agent Marsh, DODIG, Criminal Investigation Division. The man held up his ID. We've been activated on the Webb case. We're here to begin formal evidence collection. He looked down the hallway. His eyes passed over Emily and returned to Rourke. We also have a secondary referral from the U.S. Attorney's Office regarding potential obstruction of a federal medical review. He held up the document. We have a preservation order for all electronic communications and medical records associated with patients Harold Sims and Marcus Webb, and all related administrative correspondence generated within the past 24 hours. The hallway went very quiet. Including, Special Agent Marsh added with the measured tone of someone reading from a prepared statement rather than editorializing, any communications generated by hospital staff or physicians during or after the initiation of a formal DoD review, such as, for example, complaints filed with outside regulatory bodies while an active federal investigation is pending. He looked up from the document. Down the hall, Victor Langford had appeared from the stairwell door. He stopped when he saw the federal agents. He stopped the way people stopped when they encountered something they'd calculated incorrectly. Not frozen, exactly. More like a system running a reassessment it hadn't expected to need. His eyes moved from the agents to Rourke to Emily. Emily looked back at him. The preservation order in Special Agent Marsh's hand covered every email, text message, call log, and chart entry generated in the past 24 hours. It covered the licensing complaint Langford had filed 40 minutes ago. It covered the calls he'd made to his colleague and the staffing agency this morning. It covered everything he'd done since the helicopters landed, and it had arrived before he'd had time to determine what needed to be managed. The document was already in the building. The conversation was already over. And Victor Langford was standing in a hospital hallway understanding, for the first time since 6:47 that morning, that he had fundamentally miscalculated who he was dealing with. Not just Emily Carter, not just Commander Rourke, but the full weight of a federal mechanism that had been activated before he'd even known it existed, by a woman he'd had escorted out of a room while her patient was dying. His phone was in his hand. He looked at it. "Dr. Langford," Special Agent Marsh said without raising his voice, "we're going to need to speak with you." Langford didn't answer immediately. That was the first thing Emily noticed. Not that he looked guilty, not that he looked afraid, but that he looked like a man buying time inside a second, which was the same thing and worse because it was calculated. "Of course," he said finally, "whatever I can do to help." Special Agent Marsh nodded without warmth. "We'll need a private space." "There's a conference room on this floor," Rourke said, and the way he said it made clear he already knew the layout of this hospital better than some of the people who worked in it. Marsh and his team moved toward the conference room, and Langford moved with them. And his counsel, who had materialized from somewhere, which meant she'd been called before the agents arrived, which meant Langford had known or suspected this was coming, fell into step beside him and put her hand briefly on his arm in the way lawyers did when they were telling clients without words to stop talking. Emily watched them go. Then she looked at Rourke. "Obstruction referral," she said, "from the U.S. Attorney's Office." The licensing complaint he filed triggered an automatic flag when it hit the regulatory database. The timing was notable. Rourke said it carefully. Filing a complaint against a material witness 40 minutes after federal evidence collection was initiated is a pattern the system is designed to catch. "Did you know that would happen?" He looked at her. "I knew it was possible." She understood then that Rourke had been several moves ahead of Langford since the helicopters landed, and that what had looked like a reactive federal response had actually been a structured one, each element activating the next the way good operational planning was designed to work. She also understood that she had been both an asset in that structure and to some extent a variable he'd been managing around. She wasn't entirely sure how she felt about that, but she filed it for later when she had the bandwidth for complicated feelings. "The statement," she said. "You still need it. More than before. The obstruction referral strengthens the IG case, but your clinical account is the foundation of the negligence record. Without it, the medical piece rests entirely on chart documentation and other witness statements." "Give me a room." Rourke put her in a small office 2 doors down from the conference room, someone's workspace, cleared out, a recording device on the desk, and a DoD legal officer named Tron sitting across from her with a notepad, and the patient demeanor of someone who did this regularly. Emily had not slept, had not eaten since a granola bar at 11 p.m. the previous night, and her left shoulder had been aching for the past hour, from the repetitive motion of compressions during the Sims code. She sat down, accepted the water Tran pushed across the desk, and gave her statement. It took 47 minutes. She started at 22:47 the previous night, which was the timestamp on her first nursing note about Harold Sims, and she went forward chronologically through every clinical observation, every escalation attempt, every page and response and documented flag, through the code and the escort and the lobby and Rourke's arrival and Marcus Webb and the echo and the licensing complaint. She was precise about what she had personally observed, versus what she had been told. She was precise about which actions she had taken and which had been taken by others. When Tran asked her to clarify a point, she clarified it. When Tran asked her to characterize something, she declined characterization and offered additional factual detail instead. When she finished, Tran looked at his notepad and then at her. "You've given formal statements before," he said. "Military incident reporting," Emily said, "after field operations." He nodded. "It shows." She was back in the hallway at 11:03 a.m. The hospital had continued functioning around the investigation the way bodies continued functioning around injury, compensating, rerouting, maintaining the essential operations while the damage was assessed. Nurses were still doing rounds, medications were still being administered, the cafeteria was open, the sound system in the lobby was playing something instrumental and forgettable. Emily went to the second floor. Harold Sims was sitting up when she came in. Not far. He was still attached to a monitoring lead and the chest tube drainage system, and sitting up was a relative term that meant he'd gotten the head of the bed to about 40 degrees, but upright. He had a cup of something on the tray table and a newspaper that someone had brought him, and he looked like a man who had recently been reminded that being alive was not a given and had decided to treat that reminder seriously. "You look worse than I feel," he said when Emily walked in. "That's an achievement," she said. She checked his drainage output, good, appropriate volume, appropriate color, and looked at his SAT reading, which was 97 on 2 liters. His pressure was 124/78. "How's the breathing?" "Better than 4 this morning, I'll tell you that much." She adjusted the head of the bed slightly. It was pulling his tube at a faint angle that he probably couldn't feel but she could see. He let her do it without complaining, which was better cooperation than some patients managed with procedures that actually hurt. "They're asking me to give a statement," he said. "The military investigators." "Are you?" "Already did. About an hour ago." He folded the newspaper and set it on the tray. "Young woman, very official, very polite. Asked me about my admission, the symptoms I'd been having, whether I'd interacted with nursing staff, what I'd observed." He paused. "I told her the nurse on my overnight had been in my room 3 times between midnight and 5 a.m., that she'd explained to me what she was concerned about and why she was escalating, that she'd been professional and clear, and I'd felt like someone was actually watching out for me." He looked at Emily. "Then I told her what I'd heard when the alarm went off, the commotion, the voice in the hallway telling someone to keep the rate at 100. Emily was quiet. "I was in and out," he said. "But I heard that. And I heard the door close. And then I heard different voices." He looked at her directly. "I've been around long enough to know what it sounds like when someone gets pulled off a job they're not done with." She didn't say anything. She straightened the tubing one more time, checked that the connection was secure, and made a note in the chart on the bedside tablet. "My son called," Sims said, "from Fort Bragg. Someone called him this morning to let him know I'd been admitted. He's coming up this weekend." He paused. "I'd like him to meet you, if that's possible." Emily looked at him. He said it simply, without ceremony, which was the only way she could have received it. "We'll see," she said. She left him to his newspaper and his elevated blood pressure that was finally in a range that made sense, and she took the stairs back to the 4th floor because the elevator felt too slow and she needed the 4 flights to think. What she was thinking about was Langford in the conference room, the counsel's hand on his arm, the calculation she'd watched him do in the hallway. Not once, but twice, and both times his calculation had been wrong, and she was trying to understand how a man who was by any measure intelligent had made consecutive decisions that had systematically accelerated his own exposure. The answer, she thought, was that he'd spent 20 years in an environment where being wrong had never cost him enough to recalibrate his assessment of his own judgment. He'd been insulated by his position and his outcomes, and the specific institutional deference that surrounded senior physicians in hierarchical hospital systems, and when the insulation was suddenly gone, helicopters on the roof, federal agents in the building, a material witness in a room with the board chair, he'd responded with the only tools he had, which were the tools of institutional authority: filing complaints, calling legal counsel, trying to manage the narrative through the mechanisms he knew. He hadn't understood that the mechanisms had changed. She was at the 4th floor landing when her phone buzzed. Unknown number again. She answered. "Miss Carter." Male voice, measured, older. My name is Arthur Delaney. I'm a senior investigator with the DoD Medical Inspector General's office. I've been assigned as the lead on the web negligence review. I understand you've already given a statement to Agent Tran. About an hour ago. Good, I've reviewed it. I want you to know that what you've provided, in combination with the documentation we've pulled from the hospital's record system, is comprehensive. A pause. I've been doing this for 16 years. The chart record in this case is one of the cleaner paper trails I've seen. Whoever was doing that nursing documentation knew how to build a record. The night nurses on Webb's floor did most of it, Emily said. I did mine on Sims. We were all doing the same thing, flagging what we saw on the chart because that was the only tool we had. That's exactly what a record is supposed to be, Delaney said. I wanted to tell you that because I know the licensing complaint is creating uncertainty about your current status, and I want to be direct. The preliminary finding from our office, based on what we've collected in the past 4 hours, is that your actions last night and this morning were within appropriate scope and were clinically indicated. We'll be communicating that to the Nursing Oversight Board today. Emily sat down on the top step of the stairwell landing. She hadn't meant to. Her knees just decided that was where she was going. That doesn't close the complaint, she said. No, the board's process runs independently, but our preliminary finding goes into their file and it carries weight. He paused. It also means that if there's any further attempt to impede your ability to practice or to function as a witness in this review, that action becomes part of the obstruction record. She understood what he was telling her. He was drawing a perimeter around her, not as a courtesy, but as a tactical measure that served the investigation by protecting a key witness. She was useful to them. That was fine. Useful was something she knew how to be. Thank you, she said. One more thing, Delaney said. We're going to need to speak with the nursing staff from Webb's overnight floor. Do you know them? Not well. I know their names from the chart. We'll reach out to them directly. I just wanted you to be aware that this is widening. He paused. Whatever Langford thought he was managing this morning, he wasn't. He ended the call. Emily sat on the landing for 90 more seconds, which was all she was going to allow herself. Then she stood up and went through the door. The fourth-floor hallway had changed. Not physically, same corridor, same lighting, same nurses' station at the center, but the energy had shifted the way it shifted when a building became aware that something was happening in it that went beyond the ordinary. 2 of Marsh's investigators were at the nurses' station with a hospital IT representative and what appeared to be a printout of the electronic medical records access log. One of the overnight nurses, a woman named Brianna Coles, whose chart notes on Webb had been 3 of the most clinically detailed escalation flags Emily had read, was standing at the end of the hall talking to a woman with a federal ID. Coles had her arms crossed, not defensively, more like she was cold, and she was talking steadily without looking at her phone, which was the body language of someone who had decided what they were going to say before they got here. Emily walked to the nurses' station. The charge nurse, a man named Patrick, who had been on shift since 7, and who had been navigating the federal presence in his unit with the resigned professionalism of someone who had decided the best he could do was stay out of the way and keep the patients alive, looked up when she approached. Webb's last vitals, she said. Stable. Pressure's holding at 108/70. Okafor just checked him 20 minutes ago. Patrick handed her the printout without her asking, which was the gesture of someone who had recalibrated in the past 4 hours how they thought about who was and wasn't worth the paper. She reviewed it. Holding, as Patrick said. The cardiac contusion was being managed medically, and the arrhythmia risk was being monitored with the frequency that Okafor had ordered, which was every 15 minutes. The drainage output from the chest tube was appropriate. He was not out of the woods. A cardiac contusion in a patient with a recent penetrating chest wound and a 12-hour delayed hemothorax was not something you watched for an afternoon and signed off on. But he was stable, and stable was what she'd been working towards since she'd walked into that room at 7:04 a.m. She was making a note in the system when the door to the conference room at the far end of the hall opened. Langford came out first. His counsel was beside him, and she was speaking to him quietly and rapidly, in the manner of someone giving instructions that were time-sensitive and not entirely welcome. Behind them came Special Agent Marsh and one of his investigators. Marsh was not speaking. He didn't need to. Langford's face had the quality she'd seen before. Not in him specifically, but in people who had been in a room for 2 hours learning the shape of what was coming for them. The aggressive composure was gone. What was left was something more fundamental, the expression of someone who had operated for a long time inside a story where they were the protagonist and had just been shown documentation that told a different story, and the documentation was better sourced. He saw Emily at the nurse's station. He stopped walking. His counsel said something to him. He didn't respond to her. He was looking at Emily with an expression she couldn't entirely classify. It wasn't quite anger anymore, and it wasn't the contempt from the hallway at 6:30 a.m. It was something closer to the specific bitterness of someone who had decided somewhere in the past 2 hours that this was Emily Carter's fault. Not his choices, not the documentation, not the nursing notes from 4 separate staff members who had independently flagged the same patient deterioration. Emily, specifically, as if she had arranged this rather than simply refused to go away. "You should know," he said across the corridor. His voice was even. He had enough control left for that. "Whatever they're telling you, this isn't over. A nursing board complaint runs independently of any federal process. You will still have to answer for what you did in that room." Emily looked at him. She'd been awake for 24 hours, and her shoulder hurt, and she had at least 4 pending documentation items, and a patient on cardiac monitoring who needed another check in 6 minutes. She was not in a position to perform whatever this moment was asking for. "Your patient's chest tube stopped draining at 1:17, she said. "I documented it at 1:30. You were called at 6:23 and arrived on the floor at 6:41. That's in the chart. Everything else is about what happened in between." She turned back to the terminal. Marsh said, "Dr. Langford, we need to continue in the conference room." There was a pause, long enough to be noticed by everyone in the hallway, short enough that it couldn't be called refusal. Then Langford turned and walked back toward the conference room, and his counsel was already on her phone, and the door closed, and the hallway resumed its functional rhythm as though the interruption had not occurred. Patrick, beside Emily, exhaled through his nose. "How are you still standing?" he said. "Stubbornness, mostly," she said. She finished the documentation and went to check on Webb. He was awake and more alert than he'd been all morning, which was the clearest indicator that his oxygen situation had genuinely improved. Consciousness had a quality to it that monitoring numbers approximated but didn't capture, and Webb's eyes when she walked in were focused and present in a way they hadn't been at 7 a.m. "I heard something in the hallway," he said. "Hospital," she said. "Things happen in hallways." Sounded like Langford. It was. He watched her pull up his vitals on the bedside display. "How bad is it for him?" "That's not my area," she said. "That's a pretty bad answer, phrased politely." She looked at the pressure reading, 112/74, up slightly from the last check, which was the right direction. "Your job right now is to not go into VTAC," she said. "Everything else is someone else's problem." He was quiet for a moment, then, "After this. When the investigation's done and everything's settled, what do you do?" She thought about it. Not the full version, just the top layer. "Keep working," she said. "Same thing I was doing yesterday. As a float nurse." "As a nurse." He considered that. "Seems like a waste," he said, and his tone made it clear he'd thought about it and said it anyway. "Depends what you're measuring," she said. She left him to rest and walked back down the hall, and she was almost to the stairwell when Patrick called her name. She turned. He was holding the desk phone out to her. "Call for you," he said. "Hospital Administrator's Office, Ms. Heald." Emily took the phone. "Miss Carter?" Heald's voice was composed and carried the weight of someone who had spent the past 4 hours making decisions she hadn't planned on making when she arrived that morning. "I wanted to speak with you directly. The board met at 10:30, a quorum, by phone, given the circumstances. I want you to know that a formal resolution was passed this morning authorizing a full internal review of the events of the past 24 hours, independent of the federal process." She paused. "Dr. Langford's clinical privileges have been suspended, effective immediately, pending the outcome of both reviews." Emily stood at the nurse's station with the phone against her ear and said nothing. "This is separate from the administrative action that was already in place," Heald continued. "This is a suspension of privileges. He cannot practice in this facility. It will be communicated to the state medical board as required by reporting guidelines." Another pause, this one longer. "I also want to inform you that the licensing complaint he filed this morning has been flagged by the board as potentially retaliatory, and we will be submitting a formal response to the Nursing Oversight Board on your behalf." "You don't have to do that," Emily said. "No," Heald said. "We don't." A beat. "We're going to anyway." Emily handed the phone back to Patrick. She stood at the nurse's station and looked at the hallway. The clean institutional fluorescence, the monitoring equipment visible through the window of room 412, the two federal investigators still working through the access logs at the far end, Brianna Coles finishing her statement and walking back toward the station with the flat effect exhaustion of someone who had been precise under pressure and was feeling it now. Coles glanced at Emily as she passed. She didn't say anything. She didn't need to. The glance was the kind exchanged between people who had been on the same side of something and both knew it. The afternoon shifted. The federal presence didn't leave, Sab. Marcia's team was still collecting, still interviewing, still working through the documentation layer by layer. But the acute crisis phase had passed into something more procedural, and the floor was trying to remember how to be a hospital floor rather than a crime scene. At 1:15 p.m., Emily sat down for the first time since the granola bar. In the break room, alone, with a cup of coffee that was not good and a chair that was not comfortable, and she sat there for 11 minutes and didn't think about anything specific. Just let the noise settle. Her shoulder ached. Her eyes felt like they'd been open too long, which they had, and the fluorescent light in the break room was doing the thing fluorescent lights did after enough hours where they seemed slightly too bright for the visual cortex to process comfortably. She was still sitting there when Rourke appeared in the doorway. He looked at her. She looked at him. He came in and sat across from her and didn't speak immediately, which she appreciated. "Marcia's almost done for the day," he said finally. "He'll be back tomorrow." How much did they pull? Everything from the past 72 hours. Email, text, EMR, access logs, call records. He put his hands on the table. The call records are going to be significant. Langford made 11 calls this morning between 0600 and 0900. 4 of them were to people outside this hospital. A colleague at St. Marcus Regional, the staffing agency, his personal attorney, and a member of the State Medical Board's Ethics Committee. Emily set down her coffee. He called a member of the Ethics Committee. Personal call. The relationship is, they've known each other for 15 years. The investigator who pulled the records flagged it because the Ethics Committee is the body that would review the licensing complaint. He paused. It's a problem for him. It's also now part of the obstruction record. She absorbed that. Langford had called a contact on the Ethics Committee, the body that would review the complaint he'd filed against her. On the same morning he filed it, while a federal investigation was active. It was the kind of decision that made sense to a person who had always been able to manage institutional processes through relationships, and it was the kind of decision that, under federal scrutiny, looked like something else entirely. "He keeps making it worse," she said. "People do," Rourke said. "When they're trying to stop something, they can't stop." She looked at the coffee cup. "What happens to his colleague, the one he called at St. Marcus Regional?" "They're being contacted for a statement." The call was 8 minutes long. Whatever he said, it's now something an investigator is going to ask about. Emily thought about the resident, Ferris, who had told Langford that morning that he was going to document the timeline accurately because he didn't think he had a choice. She thought about the night nurses on Webb's floor, who had charted their flags and given their statements, and were probably still on shift right now because the hospital still needed nurses, regardless of what was happening in its conference rooms. She thought about the tech who'd pulled the ultrasound unit into room 412 without asking for context, who had just done the job and kept moving. All of them had made small decisions, in small moments, that were now part of a documented record that was larger than any of them had planned on being part of. "What's Langford doing right now?" she said. "Talking to his legal team in an office on the 3rd floor. He's been there since the conference room interview ended." Rourke looked at her. "He hasn't left the building." That was interesting. "Why?" I don't know. My read is that leaving feels like conceding something, and he hasn't gotten there yet. He paused. He'll get there, but not today. Emily nodded. She stood up. Her knees registered the protest of someone who had been on their feet for most of 24 hours and then sat down for 11 minutes, which was just enough rest to remind the body of how tired it was. Webb needs his 1:30 check, she said. Rourke stood too. He looked at her with the straightforward attention of someone about to say something they'd considered. For what it's worth, he said, I've worked with a lot of medical personnel in high-pressure situations. In the field and out. He paused. The way you held this morning together, not just clinically, the whole thing, that's not common. Emily picked up her coffee cup, decided it wasn't worth finishing, and set it in the sink. I just didn't stop, she said. It was the same thing Sims had thanked her for, reduced to its actual mechanism. That's what uncommon looks like, Rourke said, from the outside. She left the break room and walked back to room 412, and she was 3 steps from the door when her pager went off. She looked at it. It was the hospital's internal system, the code for a physician emergency, which was the page sent when a staff member was in medical distress rather than a patient. She looked at the room number attached. 3rd floor. Room 304. She was already moving before she'd finished the thought, because that was the room where Gerald Mast, board chair, had met with Langford that morning, and it was where Langford's legal team had set up, and if Langford was down, she hit the stairwell door. She came out on 3 to find 2 nurses already running the same direction and a security guard on his radio, and a woman, Langford's outside counsel, Emily recognized her, standing in the hallway outside room 304 with her hand over her mouth. Emily pushed through. Langford was on the floor, on his side, between the conference table and the credenza. He was conscious. She established that first because conscious changed everything. And he was clutching his left arm, and his face was the specific color of a man whose cardiovascular system was sending him urgent and unmistakable signals. Victor! She was on her knees beside him. Can you hear me? His eyes found her. The bitterness from the hallway was gone. What was there instead was something she'd seen before. The naked and involuntary terror of a person confronting the body's ability to override everything else. It's... he started. Don't talk, she said. Chest pain? He nodded. Small. Yes. Left arm radiating down? Another nod. She looked up at the nurses in the doorway. Call a code. Get the cart. She looked at the security guard. Get me an AED now. She looked at Langford's counsel, who was still in the doorway. How long has he been like this? The woman swallowed. Maybe 2 minutes. He said he wasn't feeling well, and then 2 minutes is fine. Emily was already feeling for his pulse, checking his color, running the fast assessment that didn't need equipment or orders or anyone's permission. His pulse was present, irregular, faster than it should be. His skin was clammy. His breathing was shallow but not absent. She looked at him. He was looking at her. She had been escorted out of a room by security guards on his order while her patient's heart was stopping 11 hours ago. He had called a licensing board to file a complaint against her this morning. He had stood in this hospital's hallway and told her to know her place. He was looking at her now with a face that had been stripped of everything it used to wear. The crash cart came through the door behind her. The code team was 30 seconds out. She could hear them in the stairwell. Emily Carter put her hand on Victor Langford's wrist and kept it there, and she did not hesitate. And she did not look away. And the part of her that might have felt the complicated weight of this moment filed it somewhere it would keep until she had the space to feel it properly. Which was not now, because now there was a patient on the floor and her job had exactly one requirement, and she had never once failed to meet it. The code team came through the door. Talk to me, the lead resident said, breathless. Probable STEMI, onset approximately 2 to 3 minutes ago, conscious and responsive, irregular pulse at roughly 110, no loss of consciousness. He needs a 12 lead now and cardiology on the phone before the strip prints. She was already moving aside to give the team room. Left arm involvement, diaphoretic, no reported allergies. You'll need to pull his chart. The resident was already moving. The monitor went on. The strip began printing. Emily stood up. She stepped back. She let the team work. And from the floor, between the sounds of the monitor and the team's voices and the specific controlled chaos of a code being run by competent people, Victor Langford looked up at her, at the woman he had tried to remove and discredit and silence and outlast, and his expression was something she would not be able to name for a long time afterward, and might not try to. The strip finished printing. The resident looked at it. "Call Cath Lab," he said. "Tell them we're coming." The Cath Lab team took Langford at 1:47 p.m. Emily watched them wheel him out of room 304 and down the corridor toward the elevator, the code team moving with the organized urgency of people who had done this enough times that crisis had become procedure. She stood in the hallway and watched the gurney turn the corner and disappear, and then she stood there for another moment in the specific quiet that follows when something large has left a space. Langford's outside counsel was beside her, and the woman was holding her phone and not using it, and her face had the look of someone who had arrived at a hospital this morning to protect a client's professional interests and had ended up watching that client leave on a gurney instead. She was pale in a way that had nothing to do with the fluorescent lighting. "He'll need someone to contact his family," Emily said. The counsel looked at her. Something moved through her expression. Surprise, maybe, at the practicality of it. "Yes," she said. Yes." Emily walked back to the stairwell. She didn't feel what she'd expected to feel, which was nothing specific but certainly something, relief, or the cold satisfaction of a score being settled, or even simple exhaustion arriving now that the central figure in the day's crisis was no longer in the building. What she felt instead was the particular flatness that came after long operations, when the adrenaline had been metabolized and the work was done and the body was presenting its bill. She climbed to the 4th floor. She checked Marcus Webb. She documented. She checked the output on the chest tube, still draining appropriately, color good. His cardiac monitor showed a rhythm that was irregular in the way the contusion was making it irregular, but no VTAC, no escalation. Okafor had added a second cardiology note to the chart at 1:30 that was cautiously optimistic in the way cautious clinicians were optimistic when they actually meant it. She checked Sims on the 2nd floor. His son had called again. He showed her a photo on his phone, a young man in uniform, Bragg in the background, squinting against the sun. She looked at it and said the kid looked good. Sims agreed. She finished her shift documentation at 3:22 p.m. She was at the nurse's station finalizing the last note when Patrick put a hand briefly on her shoulder. Not a long gesture, just contact, the workplace equivalent of something he probably didn't have words for, and then took his hand back and went back to his own documentation, and neither of them acknowledged it, which was exactly the right way to handle it. She clocked out at 3:40 p.m. The investigation that followed was not fast. Nothing that mattered was. The DoD Medical Inspector General's office published its preliminary findings 11 days after the events at Redstone Regional, and the document was 63 pages long and not designed for general reading, but the conclusions were clear to anyone who worked their way to them. Staff Sergeant Marcus Webb had experienced a preventable deterioration in his medical condition due to inadequate physician reassessment over an 11-hour period. The nursing documentation on file was described as thorough and appropriate, reflecting multiple timely escalation attempts by clinical staff that were not adequately acted upon by the responsible attending physician. Emily Carter was not mentioned by name in the public version of the report. Her contribution was described as the clinical intervention of a qualified former Special Operations combat medic that, in conjunction with the work of Dr. Samir Okafor, had addressed the patient's condition in time to prevent further irreversible harm. The full version, which was not public, mentioned her by name 12 times. Victor Langford survived his cardiac event. The LAD blockage was significant. The interventional cardiologist who handled the procedure described it afterward as the kind of case where 30 more minutes would have changed the outcome. He was in the cardiac unit for 6 days, and when he was discharged without his hospital credentials, without his department chair position, and with a formal notice from the state medical board that a disciplinary review had been initiated based on the IG's findings and the hospital's own internal review report. The review took 4 months. Emily was not present for most of it. She gave 2 additional written statements, answered 3 sets of follow-up questions from the IG's office, and was interviewed once by the state board investigator. Each time she reported facts and timestamps and clinical observations. Each time she declined to characterize or editorialize. She was not trying to destroy Victor Langford. She was trying to tell the truth about what had happened, and the truth was destructive enough on its own. The State Medical Board's final determination came on a Thursday in late October, 7 weeks after the preliminary IG report. Victor Langford's medical license was suspended for 18 months, with reinstatement contingent on completion of a mandatory patient safety and clinical oversight program and a formal peer review process. He was permanently removed from any department chief or supervisory role. The board's public statement used words like systemic failure, of duty of care, and pattern of inadequate escalation response, and endangerment of vulnerable patients, which were the most damning words available in that institutional register, and the board did not use them lightly. Redstone Regional Medical Center issued a formal public statement the same day. Patricia Heald had written it herself. Emily found this out later from Gerald Mast, who told her in a conversation that she hadn't expected to have and didn't entirely know what to do with. The statement acknowledged the institutional failures that had contributed to the inadequate care of 2 patients, described the internal review process, and the procedural changes being implemented as a result, and included a section that had been, apparently, the subject of significant discussion before it was finalized. It named Emily Carter. It described her as a former U.S. military special operations combat medic whose clinical observations and escalation efforts had been the primary early warning mechanism for both patients, and whose removal from active patient care during an active cardiac event represented a failure of institutional judgment that the hospital deeply regretted. It stated that the hospital was grateful for her service and her continued commitment to the patients in its care. It used the word grateful twice, which Mast had apparently pushed for over the objections of 2 board members who felt once was sufficient. Emily read the statement in her car in the parking garage, on her phone, during her lunch break. She read it twice. Then she put her phone down and looked at the concrete wall in front of her for a while. She wasn't sure what she'd expected to feel about being named in a hospital press release. She hadn't been working toward it. She hadn't been working toward recognition of any kind. She'd been working toward Harold Sims breathing and Marcus Webb's pressure holding and Ferris having the information he needed when the alarm went off. Those things had happened. The rest of it was institutional machinery processing what she'd set in motion, and institutional machinery was slow and imprecise and ultimately necessary and almost entirely beside the point of the actual work. But her name was in it, and it had not been there in the version of herself she'd been building here. The invisible float nurse, the quiet, competent presence who didn't need to be seen. That version was finished. She'd understood that on the morning when the helicopters landed, and she'd had 2 months to adjust to what it meant. She was still adjusting. She finished her lunch and went back inside. Marcus Webb was discharged from Redstone Regional 12 days after his admission. The cardiac contusion resolved without requiring surgical intervention. Okafor's conservative management had worked, and the follow-up imaging at day 8 showed the left ventricular wall recovering with what the cardiologist described as better than expected integrity, which was the medical community's version of relief. He came to find Emily before he left. She was on the 2nd floor when his escort, one of Rourke's personnel, who had been rotating through the hospital in pairs since the first morning and showed no sign of being in a hurry to stop, came to tell her someone wanted to see her before discharge. She went up to the 4th floor and found Webb in the hallway outside room 4, 1-2 in civilian clothes for the first time, looking like a person rather than a patient. He was thinner than he'd been, she estimated, before the extraction injury, and he moved with the careful deliberateness of someone who had recently been reminded that the body was not invulnerable. But he was standing. He was dressed. His color was the color of a living person rather than the gray undertone she'd walked in on at 7 in the morning 11 days ago. She stopped in front of him. He looked at her. "They said you were there," he said, "when Langford went down." "I was." "You helped him." It wasn't a question, but it carried one inside it, the unasked version being, "How did you do that?" She understood what he was asking, not mechanically. He knew she knew how to respond to a cardiac event. He was asking about the human part. "He was a patient," she said. That's the whole answer. Webb looked at her for a moment. She could see him turning it over, testing whether it was simple or whether she was making it sound simple. She didn't explain further. It was simple. The difficulty of it didn't make it complicated. It just made it hard. There was a difference. Rourke wants to offer you something, Webb said. Officially. A consulting role with the SOCOM medical training program, working with field medics on trauma management and triage protocols. He paused. I'm not supposed to be the one telling you this. He wanted to do it formally. Then why are you telling me? Because I wanted to see your face when you heard it. He said it without embarrassment. And because Rourke does things by the book, and sometimes the book takes a while. Emily looked at the hallway. The fourth floor she'd walked into at 7:04 a.m. 11 days ago, with no badge and no authority, and a patient who had asked for her by a name she'd been trying to leave behind. She looked at the monitoring equipment visible through the window of the room that was no longer Webb's. I'll talk to Rourke, she said. Webb nodded. He held out his hand. She shook it, which felt insufficient for what had happened between them, and also exactly right, which was the nature of handshakes between people who had been through something and had no better ceremony for it. Carter, he said when she started to turn. She looked back. You didn't have to stay, he said. Any of those hours. You were off the clock before any of it started. You were being walked out the door. He paused. I don't know why you stayed. She thought about it. She thought about Harold Sims' vitals trending in the wrong direction at 1 a.m., and Langford's voice saying, know your place, and the elevator opening into the lobby, and the sky outside being wrong, and Rourke saying Valkyrie in a hospital lobby like it was a key finding a lock she'd been pretending wasn't there. I stopped knowing how to leave things unfinished, she said. A long time ago. He held her gaze for a moment. Then he nodded. Once. The nod of someone who understood exactly what she meant and didn't need her to say more. His escort came around the corner with a wheelchair. Hospital policy, end of the discussion. And Webb looked at it with the expression of a man deeply opposed to wheelchairs on principle and aware he was going to sit in it anyway. Emily left him to that indignity and went back to work.